Welcome back to this segment of Healthcare Consumerism Radio. This is Brent, Macy, and Doug Field coming to you from the studios in Sandy Springs, Georgia. And we'd actually like to welcome Mike Meyerring from Businessolver onto the program. Mike, how are you doing?
Good. Good morning, Brent, Doug.
Good morning.
Hope you're doing well. Kind of give our audience an overview of Businessolver. You guys have been around for a long time. Kind of give them a feel for who you guys are.
Yeah, absolutely. So Businessolver is a benefit administration organization that's been around for 16 years, and we've really focused on trying to continue to provide employers tools to engage their employees as it relates to their benefits program. So we've had a lot of experience in serving the marketplace model for a number of years, 14 to be exact. So really excited to have an opportunity to talk today about private exchanges.
Yeah, tell us about that, Mike. When did you roll out your private exchange?
Yeah, so as a private exchange, in my mind at least, if we define the private exchange, really the simplest way to do this is to say employers are trying to control their expenses, and they're trying to offer a lot of choices to their employees to help them choose the right benefit plan for their lifestyle. So as a benefit administration organization, we've been supporting benefit trusts, benefit associations, these marketplace models for a number of years. So, when we talk about our technology supporting this model, really it comes down to, from the employee experience, we offer them decision support, whether that's through our decision support tools online or live service center support so they can speak to someone. We have the ability to drive education through hard copies being sent out, and really that's solving for the generational gaps of those communication needs. And then when we think about the employers from a private exchange, we're offering them integrated tools so they can continue to drive strategy, stay in touch with their employees, connect with them, offer defined contribution, which is totally not a new concept. Do the reporting, get integrated with their payroll, and offer them some consolidated billing. So a couple of aspects that we support there.
It's interesting. At IHC Forum West in December, I led a share session on defined contribution private exchanges that was very interactive. But towards the end, it got a little heated, not in a bad way, in a very positive way. But somebody raised their hand and says, "What is an exchange?" Another person raised their hand and says, "It's simply benefit admin on steroids right now at this stage in the marketplace." Would you kind of agree with that to a point?
Yeah, I think to an extent. I think that there's a lot of confusion out in the industry today about what a private exchange is. Yeah. But, really, if you look at the industry as a whole, medical insurance premiums continue to increase, and so it's becoming an issue for employers to continue to leverage benefits and offer them as a talent retention tool to their employees. So, a private exchange, the simplest term, is how can the employer control costs and still attract the best talented employees? And so there's a myriad of different ways that we believe you can slice and dice this thing. And, I don't necessarily think a private exchange is too different than an employer offering multiple plan choices to their employees and changing the way they fund it.
Yeah. And Mike, if you look out at the marketplace, you got a lot of employers. I think there's a lot of studies that we've seen anywhere from 40% of employers are going to look at a private exchange to 90% of employers. So we kind of look at it and let's fall in the middle somewhere. That means a good amount of employers are going to look at this option. Doesn't necessarily mean that they're going to go this direction. But from a sustainability standpoint, do you see a private exchange sustaining itself moving forward in this marketplace?
I think you're going to see some winners and you're going to see some losers. And I think that some of the private exchanges that will be sustainable will come down to what is the overall strategy of the exchange. So does that exchange have the ability to engage employees and drive population health management? The exchanges that are developing strategies around that, those will be the ones that will be sustainable. I think the exchanges that are simply throwing products at employees, even if they have decision support tool, I think those will be the losers. In fact, there's a great article by the Employee Benefit Research Institute a while back that talked about offering multiple, when you look at pension to 401k, offering multiple product options to employees. It was paralysis by analysis. So those exchanges that are just simply throwing a lot of products at employees that they've never dealt with or never been faced with having to choose and make a informed decision, I think that's just going to be the exchanges that won't be sustainable.
So Mike, how does an employer know which model is right for them?
That's a great question. I think the most important thing is the employer has to understand, how have you been leveraging your benefits to this point, and how do you want to leverage your benefits moving forward? And then you need to find the exchange that's going to match that strategy. So and there's going to be a lot of exchange options out there. But when you sit down with your benefit broker or consultant, you need to ask them or give them your short list of, I'm looking for an exchange that can help us continue to drive employee engagement or continue to drive our wellness program or population health management. And then you have to actively go out and find an exchange that aligns with your strategy. Because what we're seeing with our population is, even if an employer is considering moving to a private exchange, they don't want to lose that connection with their employees. It's still an extremely important aspect to their total compensation. Guardian came out with a report recently, 71% of all employees still feel that their benefit offering is extremely important. So this is still a major tool that employers are using to really separate themselves from each other, which is attract talent.
Yeah, because if a private exchange is done the right way, it does provide, to your point, that complete health care and health management experience, health care benefits and health care management experience, including some of the transparency tools. It actually can improve that connection, correct, with employees?
Absolutely. And I think that what will be important there is that the connection is made available through different communication styles. As we look at the generational gaps that exist today, every generation may want to receive their information differently. And by that I mean they may want to have education where they go online and they research it themselves. But not all employees are going to be that way. Some folks may want to call and talk to someone live and have a counselor that can help them. Or, perhaps they just want to have the information pushed to them. Send me the benefit booklet through the mail. Let me read through it and review it myself, and then I can call someone and get help on the enrollment. But you have to be able to deploy those methodologies, in our opinion, so that you can really stay connected with all of the different flavors or styles of communication preferences.
Mike, you had mentioned earlier in the segment that the exchanges that are going to win are going to be the ones that really look at the total population health piece. Where is that connection in the exchange? Is it something that Businessolver goes out and says, hey, I'm going to go partner with and this is just an example, a Healthways, a Red Brick Health, or someone who's in the total population health management business specifically, and I'm going to embed them into my exchange? Or is it something that's going to be sitting outside of the exchange that you're going to need to educate the employer on to make sure that your exchange platform is successful for them married to this health management program?
That's a great question. The way that I would describe it is we have roles at Businessolver that are responsible for strategic initiatives with our clients. And so we would expect that they would get involved with the employers, with the brokers, and develop and identify who that particular strategic partner is going to be for population health management. And then, it is a bit of an educational standpoint where we can help that employer understand where are the connections, how can they lever the different tools, and how can we all play together so that it's going to drive the overall population in a particular direction. So, in our opinion, the best way to do that is you have to be able to integrate with different carriers, with different providers, because your medical insurance carrier is going to have some unique tools that they can bring to the table that you need to be able to get those employees over there. Your population health management provider may have some unique tools, so we need to help to be able to drive those employees to all the different tools and features that be available to them.
That's good points, Mike. Mike, before the segment's up, you make a good point about a piece that is not a small piece that I think needs to be addressed, and that's the subject of identity theft and what exchanges do to protect, and what are you guys doing specifically to protect, the consumer?
Yeah, and I'm glad that you bring that question up. With the exchanges, we see a number of technology providers that are coming to the table, and so employers will have many more choices of where they want to put their employees' data. And if we look at the Target data breach and the revenues having a significant hit as an outcome of that, there's real risk of choosing an exchange that has a technology backbone that isn't doing the proper audits to make sure that their security is where it needs to be. And so one of the things that we've done at Businessolver is we invest, and it's not cheap, but we invest a large portion into third-party audits to have independent people come in, do the SSAE 16, do the network penetration testing, because at the end of the day, you have real employees with real dependents sitting on a system, and the last thing that you want to do is have it be hacked. The public exchanges, read an article yesterday, public exchanges are going to be a hotbed for hackers, and there's a lot of concern because there's not security being done. So as employers are looking for exchanges, they need to know what questions to ask, and the brokers and consultants certainly need to make sure they're going through and checking to ensure that the security providers are going through the necessary audits, because nobody wants to be in Target's position.
Right. Mike, we got about a minute left on this program. Kind of give our audience the one point on where you see the exchange market moving, and then let them know how they can find you guys if they have any more questions about kind of your products and solutions.
Yeah. So I think the private exchange model 10 years from now, let's just say, you're going to see those exchanges start operating as pooled insurance groups. They're going to be running some self-funded models, but the ones that will still be around are going to be the ones that help employers engage their employees, become productive employees, and really offer the most support across all of the different generational gaps. And to find out more about how we're supporting private exchanges and what our experience is, they can go to businessolver.com, and we'll have a bunch of information out there and some numbers that they can contact us.
Hey, Mike, thanks so much for joining us on the program today. Have a great weekend. And our audience, Businessolver will be exhibiting at IHC Forum and Expo here in Atlanta in May. So you will be able to go by, see their booth, understand their solutions, and we encourage you to do that. Mike, again, thank you so much. And to the rest of our audience, please stay tuned for the next segment of Healthcare Consumerism Radio.